service providers in hospitals. According to Department of Health Undersecretary Maria Bergier, because we are under quarantine, couples may not be able to visit health centers to avail themselves of family planning services and supplies. So we want to remind couples to do what is necessary to prevent unwanted pregnancies. This is following to the warning of the United Nations Population Fund that there are possibilities that 7 million unwanted pregnancies worldwide.
So next, we have the commonly used family planning methods. First, we have the birth control pills. These are oral contraceptives that must be taken daily. The method is often recommended for both women who are religious in remembering daily doses and those who desire to restore fertility quickly. Here are their advantages and disadvantages. Advantages. Aside from its birth control properties, the pill also has health benefits. Both progestin only and combination pills lighten periods, reduce the intensity of menstrual cramps, and lessen the possibility of ectopic pregnancy. It also helps prevent bone thinning acne, ovarian cysts and cancers, breast cysts, and endometrial cancer, infection, and iron deficiency. Women on the pill can get pregnant immediately after stopping it. It is one of the reasons why most women prefer the method. Also, taking the pill is made easier to remember with easy-to-bring small pill packs. Disadvantages. What women don't like about birth control pills is the daily routine of taking it. Like other medications, pills have their own set of side effects. They experience changes in sexual desire, bleeding between periods, nausea, and sore breasts. Next, we have the barrier methods. Basically, they work in preventing the sperm from getting close or in contact with the egg. They prevent the spread of diseases as well as promote sharing of birth control responsibilities. Under barrier methods, they use diaphragms, female and male condoms, as well as cervical caps. Advantages. They are simple to use, widely available, and must be used before intercourse only. They protect both parties from possible spread of sexually transmitted diseases and are not contraindicated against most allergies. Disadvantages. It is extremely rare to use the male condoms perfectly as they are easily torn apart. Also, frequent users report reduced arousal during sexual intercourse with the use of it. Next, we have the long-term contraceptive methods. For individuals who would want to get pregnant in the future but are not into regularly prepping up against contraception, long-term methods are the best tools to use. These methods include vaginal ring, contraceptive shots, intrauterine device, and implantable rod. These are not easily reversible and non-hormonal. However, fertility immediately returns when the woman decides to discontinue its use. Advantages. The long-term effect of not having to remember daily routine is the biggest advantages of using the methods. It is extremely effective in preventing pregnancy, although a few methods halt menstrual periods. Disadvantages. The long-term contraceptive methods do not protect either of the parties from contacting sexually transmitted infections. Most of these methods require surgeries for both the insertion procedure and the removal of it. Most common side effects include weight gain, nervousness, irregular menstrual period, hair loss, and episodes of depression. Those with maintenance medication are also discouraged from using any of these long-term contraceptive methods. And lastly, we have the natural family planning. It is the sole option that produces no negative health impact and is completely free. According to American College of Obstetricians and Gynecologists, they explain that NFP only necessitates full awareness of a woman's body cycles, especially when she is the most fertile. Advantages. It is the healthiest fertility regulation method. It, it does not interfere with the menstrual cycle or make use of chemical and hormones that pollute the environment. It is also it is also easy to use and familiarize. Both culture and religion permit the use of natural family planning because of its moral principle, constantly promoting better couple communication. Disadvantages. The primary disadvantage is abstinence when a woman's biology is the most interested in being intimate. It needs training from a healthcare professional to establish the unique physiology of a woman's cycle. And for most couples, it requires a huge lifestyle change.
For our personal stand, we are in favor with family planning because aside from the advantages mentioned earlier, um, said here below, additional advantages towards family planning. It can prevent unwanted pregnancies and transmission of sexually transmitted infections, such as HIV and AIDS. Next is, with family planning, infant mortality rate is 45% higher than it is when births are 2 to 3 years apart, and 60% higher when births are 4 or more years apart. So the infant mortality rate is higher as the years apart of the child are is high also. And next is sustainable population growth and economic development for countries. So sustainable population growth since the pregnancy are controlled. What are the benefits of using family planning towards the house towards inside of the household? With mother, family planning enables the mother to regain her health after delivery. Also gives her enough time and opportunity to love and provide attention to her husband and children. He can also gives more time for her family and own personal advancement. When suffering from an illness, family planning gives enough time for treatment and recovery. Healthy mothers produce healthy children. Children also will get all the attention, security, love, and care that they deserve. It lightens the burden and responsibility in supporting his family, enables him to give his children their basic needs like food, shelter, education, and better future. With family planning also, the father gives time for his family and own personal advancement as well. When suffering from an illness, gives enough time for treatment and recovering as well. Aside from those advantages mentioned, of course, disadvantages also comes with it. We cannot deny the fact that there are also disadvantages, and that's where debating issues can insert. So here are some of the debating issues towards the different methods used in family planning. So moral issues in sterilization. Women do not always understand the permanence of sterilization. Another moral issue in sterilization also is that patient race, ethnicity, and socioeconomic status influence physicians' contraceptive recommendations. There is now a range of equally effective reversible alternatives to sterilization. Many clinicians and policy researchers have suggested that Medicaid consent requirements for sterilization merit revision because they present a barrier to desired sterilization for some women. And obstetrician gynecologists recognize women's legitimate claims to avoid pregnancy and pursue pregnancy when desired. When it comes to contraceptions, here are some of the moral issues. So, to some, contraception is inherently wrong. Contraception is unnatural, it is anti-life, it is a form of abortion, and separates sex from reproduction. Another issue in contraception is that it brings bad consequences.